All right, head to toe assessment for MedSurg 121B. Knock, knock, knock. Hello, my name is Chad. I'm gonna wash my hands. So, hello, my name is Chad. I'm gonna be your nurse for the day. Could I get your name and date of birth? Give me their name and date of birth. I'm gonna verify it on their right wristband. Thank you. Do you have any allergies? Allergies to sulfamides. Thank you. Awesome. So we're just gonna do your head assessment, okay? So I'm gonna close the blinds for privacy or close the door. Now I'm just gonna ask a couple questions. Do you know where you are? My room. Do you know what time it is or what day it is? It's around the afternoon and it's Monday. Do you know who the President of the United States is? It's Donald Trump. And do you know why you're here? I'm doing an assessment on myself. So ANO times 4. Patient is able to speak clearly. Seems like they can hear fine. I can do a snap test to double check. And then I have a mint stick. Oh, and then I could also have a mint stick to have them smell, but I'll do that later. Are you in any pain? Yes or no? If they say no, 0 out of 10, we'll say whatever. 2 out of 10 on the pen scale. Yeah, yes I do. But it's like a 2 on 2 out of 10. So yes, they have pain. So I'm gonna start with the head. I'll palpate the head, check the hair, skin integrity, see if anything was up. Check the back of the ear for battle signs. Grab my pen light, check the ear for any blood or drainage. Now I'm gonna check the pupils for Perla. So the pupils dilate. Pupils dilate 2 millimeters. Check for accommodation. Pull it further out, closer in, up, down. And then do you have any glasses or do you wear any contacts? Yes, no. No, I don't. Okay, so the cranial nerves 2, 3, 4, and 6 are good. If they need to, I'll have a mint stick. They can smell it. That'd be cranial nerve 1. Of course, if they're hearing, snap. Where do you hear that? It's on my left. Do you hear that? Yes, it's on my right. Okay. Then I'll continue. Check the nose for any drainage, any dryness, cracks. Same thing on the lips. Dry lips. Ah. See if there's a swollen tongue. Check the gums. Any bleeding, anything like that. When was your last oral intake? It's probably this morning for breakfast. And do you have any dentures? No dentures, and I'd smell if they have any bad breath. Now I'm going to check the lymph nodes, preauricular, postauricular, tonsillary, submandible, sub something else. And then there's like anterior clavicle. Then I'll check their neck for signs of JVD, jugular vein distension. Check if their trachea is midline. And I'll palpate their carotid pulses separately. All right, they're good. Now I'm going to inspect the chest, give it a feel with the back of my hand for temperature. Look at the color, check for tenting. We're good. Any signs of bruises, nothing like that, so we're good. For the shoulders, if they're able to, I'd have it do on their range of motion for themselves, or I would do it actively till it hurt, and I would stop for when it started to show signs of hurt. So they're good. Check the elbows. I'm gonna inspect the arms for any IV sites or bruising. Feel it, check for symmetry. Oh, can you smile for me? And if they can smile, that means there's no slur, so your face has symmetry. So, continue on. And then bilaterally, I would bilaterally check the radial pulses at the same time. Then I would have them grip my hands at the same time for neuro. And then I'm going to do cap refill on both hands, each finger. Cap refill is 2+, we're good. Now I'm gonna check for the lung sounds. Deep breath. It's over here. And then while I'm here, I'm also going to check for the heart sounds. Second intercostal space, right side for the bicuspid valve. Second intercostal space, left side for the pulmonary. Third intercostal space, left side for the tricuspid. For Erb's point. Then the fourth intercostal space for the tricuspid. And then the fifth intercostal space, mid-clavicular line for the mitral valve. Now, if the patient's able to, I'd have them sit up, roll on their sides. If not, I'll have a nursing assistant help me roll them over. So I'm going to check their back. I'm going to inspect their back for any bruises, skin integrity, moles. I'll feel for the temperature, look for any color. And then I'll pay special attention to bony prominences for any pressure ulcers or anything like that. Check all the way down from here, all the way to the heels, so everything is good. And then for the posterior lung sounds, check here. Avoiding the scapular and the spine. Alright, so now we're going to do the GI. I'm going to lift their shirt, cover them up. I'll do inspection. I'll inspect for any ostomies, any distension, any bruising, any roundness. And then I'll also ask them if they have any nausea or vomiting, when was their last bowel movement, and if it was normal. It depends on the patient. So my patient says their bowel movement was normal, it was last night. And gosh, there's something else. Nausea, vomiting, and if they're eating well. So yes, no, I'm eating well. So yeah, currently inspecting, roundness, distension. Then I'm going to auscultate at the lower right lower quadrant. And the answer is no bowel sounds. Bowel sounds are present. If they were not present, I would spend 5 minutes on each section. And then I would percuss, but I don't know how to do that. And then I'll palpate lightly, just make sure nothing hurts. And then something I forgot to ask them, but to make sure, are you a smoker? Yes or no? Do you smoke any cigarettes? No. And do you have a cough? And if so, is there any productive mucus in the cough? So that would be another thing I would have asked while doing lung sounds. So now I'm going to go to the perineal area. Of course, you cover them as best you can. Then you would ask if they're sexually active. For a female, when was their last menstrual cycle? Any vaginal discharge or bleeding. For a male, any penile discharge. So they're good. And then we're going to go to the legs. I'm going to check the legs for symmetry. Feel them for, look for any bruising, signs of bruises, edema. I'm going to feel for temperature, color, all that stuff. Check range of motion. Alright, check for pitting edema. Feel the bottom of the calf for Any signs of deep vein thrombosis. Bilaterally feel the pedal pulse. Ask them to press on your foot as hard as they can for neuro to pull up. And if they can pull up, that's a negative Homan sign. Cap refill on each toe. And that would be it. Tap refill is good. Everything's good. And then take note for any potential fall risks. If they use a cane or a walker, so you'd ask them, do you walk with a cane or a walker? No. Fall risks, if they can use the bathroom on their own. And last, do you feel safe here? Yes or no? Though if they feel safe at the hospital, maybe they might have abuse at home if they don't feel safe at home. So you'd ask them, are you safe at home? No, yes. And then that'd be it. I would wash my hands. So we finished the assessment, raise their bed or lower their bed, put rails up, and call light, and that's it.